Hey guys, welcome back to the channel where I cover missing persons, unsolved cases, crime news, and more. So today was a crazy day in the trial of Monster Dad, Christopher Greger. The state called their last witness and man, did the defense attack her. It's crazy. So I'm going to kind of go through it. Not through the entire testimony, because as you guys know, it's long. It's always very long. So I'm going to kind of sift through the state's portion of questioning her and get to a good portion of what the defense, when they questioned her as well. So let's get into it.
Dr. Feingold, were you contacted by the Ocean County Prosecutor's Office in regard to the death of Corey Mitchell?
I was. Excuse me, I was.
Were you asked to conduct a review and rendered an expert opinion in that case?
I have, yes.
Did you prepare a report?
I did.
Would having it in front of you help you with your testimony today?
Absolutely.
Your Honor, may I approach the witness, please?
Yes, of course. You have to ask.
Thank you. S-161. I'm showing you what's been marked for identification as S-161. Is that your report?
It is.
I'll leave that with you. Dr. Feingold, did you have the chance to physically examine Corey?
I did not.
What did you review in reaching your opinion that you're here to give today?
I reviewed all the discovery that your office provided to me for the case.
And when you say all of the discovery, about how many documents did you review? Not just pages, but entire documents.
104 documents, pieces of evidence.
And did you review any electronic items of discovery provided to you?
Yes, I did.
About how many of those did you review?
Maybe another 30. I'm not sure what the number.
Now, were there certain records that were of particular importance to you?
Yes. In order to render an opinion, the specific records which I found most relevant to me were the timeline that was given of the occurrence of events, the autopsy report by Dr. Ragazza, and then specifically the 4 medical records from the institutions where Corey was examined at the Ivy Pediatrics, the Community Medical Center here in Toms River, Jersey Shore University Medical Center, and Southern Ocean Medical Center. I also reviewed the report by Dr. Catherine McCann's, the forensic report from Dr. Thomas Andrew, the forensic report from Dr. Michael Bagden, and the short movie clip video of when Corey's mom was speaking to him in the car, and all the medical labs, including the toxicology reports and microbiology reports that were available.
Did you review Dr. Ragazza's report as well?
I did. I mentioned that, I thought, yes.
And did you review, as part of those over 100 documents, police reports and statements and transcripts?
Absolutely.
And photographs?
Everything that was available to me.
Now, after you reviewed all of that material, did you render an opinion with respect to whether Corey died as a result of some infectious process?
I did.
What was your opinion?
My opinion was that there was nothing available in all the discovery and the medical records that were consistent with infection causing Corey's death or even playing a role in it.
When you say nothing available, it didn't exist?
I didn't see anything that suggested infection.
And is that opinion to a medical degree of certainty?
Absolutely.
Now, did you review, or you said you reviewed the records from Ivy Pediatrics, right?
Yes.
And that would be by Dr. Deacon?
Yes.
Was there anything within those records that was important to you in regard to formulating your opinion that you're here to give?
Yes, so that visit occurred the day before Corey's death at about 5:20 in the evening, and at that time, Corey was described as having had no fever, no complaints of any kind of physical ailment other than the marks on his body for which his mom had sought evaluation. He was afebrile, so no fever. His vital signs were completely stable, and he, on physical exam, there was no abnormality, and in specific, the amount of oxygen in his blood was normal. He appeared to be completely well and have normal activity. His lung examination was completely clear, no abnormal sounds in the lungs. And so at that time, with a physician evaluating him, there was no evidence of any kind of infectious process.
And is it fair to say that was about 24 hours before Corey died?
Exactly.
Did you review the records from Community Medical Center?
I did.
And was there anything within those records that was important to you in regard to formulating your opinion?
Again, the findings were very similar. The vital signs were normal, meaning there was no elevation in his respiratory rate, in how quickly his heart was beating, and once again, he had no fever. In addition, he was described as alert, in no distress whatsoever, and his lungs were described as clear with no abnormal breath sounds. And so once again, and this was just a few hours later, but a second physician's evaluation found no evidence of an infectious process.
And what about his mouth and his throat? I'm not going to use the technical words because I'll definitely mispronounce them, but what about his mouth and his throat?
Right, his mouth looked normal. He had normal amount of, sort of saliva and normal findings of his mucous membranes, and his throat was not red. There was no pus on his tonsils. So his exam was described as a normal, healthy child.
What about his lungs and his respirations at that time?
Right, his respiratory rate was normal. The oxygen in his blood was 100%, and he had no trouble breathing. He didn't work hard to breathe at all, and when they listened to him, there was no problem and no abnormal sounds or decreased sounds suggesting pneumonia. There was nothing in the lung exam there was nothing in the exam at all that they mentioned that suggested in any way that he had an infection.
And was all of that information up to that point important to you?
Yes, because what it was laying out was a time course, and so 24 hours before his death, he had no signs that he had an infection.
Did you review the medical records from Jersey Shore University Medical Center?
I did.
Was there anything within those records that was important to you in regard to formulating your opinion?
In addition to the findings that had been noted in the other visits, he had some laboratory work done at a Jersey Shore, which revealed a normal white count. So the sort of cells in his bloodstream that are fight infection were normal. That was a normal distribution of the kinds of cells that were there, and the only abnormality on his blood work was a slightly, sort of almost insignificantly elevated test of coagulation, the upper limit being 39, hinges of 40. That's really not anything we would pay attention to and consider sort of noise in the system. The other important information that was gathered at that visit was that Corey had no evidence of a significant viral infection, respiratory viral infection. So he was tested for COVID, he was tested for respiratory syncytial virus, he was tested for influenza, A and B, and those were all negative. So again, the conclusion reading this was that he was, a well-appearing child other than the bruising that was noted. And he was described by the nurses as alert, appropriate, and walking normally with a steady gait. So again, this being the third evaluation, and we have 3, physical examinations by physicians all of whom believed that this child was, and he did, look completely healthy, other than the bruising.
Do you recall approximately what time the blood was taken from Corey at Jersey Shore University Medical?
So this expert, many, many years of pediatric experience. Again, I'm going to put her name in the information of the video. But I wanted to pause momentarily because they do not only obviously show Christopher reaction, which we really don't get any reaction out of Christopher for the most part. But there's Daddy. Daddy doesn't look too happy, does he? That's because he's hearing some hard truth. It's hard to hear that your grandchild didn't die because he had pneumonia and sepsis. He died because your son beat him to death.
Medical center.
It looked like it was drawn around almost 11 p.m. Not quite, but
All right.
10 minutes shy of 11 p.m.
And so you went over there being a skeletal survey.
I didn't mention that, but there was no evidence of fractures from, I didn't mention it here, but that the skeletal survey was read as normal.
And no evidence of anything wrong with Corey's lungs at that time.
That wasn't mentioned specifically. I think had the radiologist seen anything in the lungs, he or she might have noted it, but that's not what that study concentrates on.
I understand. And so you mentioned the white blood cell count. Why is that measured?
The white blood cell count is measured because you can often find evidence of either inflammation, a stress response to a number of things, one of which can be infection, and that the white count may reflect changes suggesting that.
And you talked about the different cells that make up a white blood cell count. Could you
So there are 2 major populations of white blood cells. The neutrophils or granulocytes, which are the cells that typically respond to a bacterial infection, and then the lymphocytes, which are a different group of white blood cells that typically are elevated in viral infections in general. These are just broad general terms that can, in specific circumstances, things can be different all the time.
So what about the neutrophils and the lymphocytes in Corey's white blood cell count when he was at Jersey Shore less than 24 hours before he was pronounced?
They were completely normal, and the distribution was normal. There was nothing striking. It just looked like a normal child CBC, complete blood count.
And you mentioned that everything else in the blood work, as far as you're concerned, was normal and unconcerning.
Right.
Was there anything within those Jersey Shore records that was important to you in regard to formulating your opinion, or what did that mean to you, the Jersey Shore records?
Right. Well, the concern is that typically children develop pneumonia following a respiratory viral infection. That the virus sets them up to get a bacteria into the lungs that can cause infection. And at this juncture, not only was he afebrile, looking completely well, he had no evidence of typical respiratory virus. Now, they didn't test for all of them that are possible, but the big 4 that we worry about were ruled out at this visit.
Now, taken together, what, if any, significance did you assign then to those 3 medical evaluations that Corey had, the 2 that occurred on April 1st and then one that started in the late hours on April 2nd and ended in the early morning hours. I'm sorry, in the late hours of April 1st and ended in the early morning hours of April 2nd.
So just, reviewing this history, that this child was seen 3 separate occasions by 3 physicians, and nobody felt that he had any sign of infection and that there was anything wrong other than the bruising. And so at this point, when he leaves the Jersey Shore Medical Center at, I think it was 1 a.m. on the 2nd, he's a well-appearing child from an infectious disease point of view. He has no evidence of having an infection.
Now, in addition to the medical records, was the case history here important to you?
Yes. What the information that was reported was that Corey went home with his mom and went to sleep, and the next morning, according obviously to the mom and the grandma, the maternal grandmother, he looked well in the morning. And it was reported that he ate breakfast, bagel and yogurt, I believe. Children who are sick, and typically children who have fever or have a significant infection, have what we call anorexia. They don't want to eat. I mean, a lot of us don't want to eat when we feel really sick. So similarly, kids will not, wake up and eat their normal breakfast if they're ill or have a fever or are starting to get an important infection. It's just unusual.
Now, you had mentioned in the discovery that you reviewed that there was a video of particular importance to you. Could you tell us about that? When I listened to the 33-second clip that was taken in the car, Corey spoke, not a lot, but he spoke to his mom, and he had no shortness of breath. So, sometimes when people will call us and say their child is having trouble breathing, and we'll say put the child on the phone and see if they can give a full sentence without having to take a breath. Or the other thing that was notable was that he never coughed, and you never heard any other sounds except for the mom and Corey speaking. There was no wheezing heard or anything like that. But just he clearly was speaking normally by report, and by the video he sounded like, a regular healthy kid. So there's no moaning in that video that you heard?
No, none.
Now, if someone had actually been suffering from an infection, a real infection, what would you have expected to be different?
It would be unusual even for 33 seconds to go by for a child who had a significant pneumonia not to cough, or when they spoke to sound short of breath. To some extent, you can usually hear that in a child's voice.
So would you expect that a person that was sick with an infection would have trouble talking like you described, or walking, or climbing a set of stairs?
Yes, if somebody has a significant pneumonia, they get short of breath trying to do those things.
Now, what is your impression of Corey's condition later in the afternoon of April 2nd when he was brought to Southern Ocean Medical Center?
Well, at that time, he was obviously critically ill. He was described as ashen and very pale. He had what we call altered mental status, so he wasn't appropriately awake. He was described as somnolent, so that suggests maybe that something's going on in his head, or he's not perfusing well. He was disoriented. He was difficult to arouse. But despite those sort of severe symptoms that are extremely concerning, he had they described no abnormality on his listening to his chest. And they did say that he was breathing quickly.
but there was no distress, respiratory distress, no retractions. That's when you pull so hard to bring air in that you can see, the ribs or the muscles. You can see the muscles of the neck working to help. And there was no wheezing, no crackles associated with pneumonia, no abnormality on the lung exam to suggest a pulmonary infection.
And those are all things that you would expect to see from someone that had a pulmonary infection.
Yeah, absolutely. And also somebody who comes in looking this ill, if this was due to a pulmonary infection, I would expect very significant changes in the ability to breathe and his pulmonary exam.
Now, are you...
So she is pretty clear with her explanation that Corey didn't have pneumonia. He wasn't in distress. He left the hospital like 1 a.m., went home with his mom, totally fine, woke up the next morning, had breakfast, and Bree, his mama, dropped him off to Monster Dad. And it's only after that point that all of this happened. It is obvious something happened inside of that apartment with Christopher Greger. Alright, so I'm going to jump to the defense, the cross-examination of the doctor, and Christopher's attorney, Mario Gallucci. He really is testing the waters as soon as he starts questioning this doctor. It is crazy.
Thank you, Judge. How are you, Doctor?
I'm all right.
I can't hear you, I'm sorry.
I'm all right.
All right. So, why do we have forensic pathologists?
Objection, Judge. Is it a quiz?
No, it's a question. Why do we have forensic pathologists?
Sarcastic, Judge.
I mean, if you're telling me that...
Your Honor, I just wanted to hear Your Honor's ruling on my objection.
Well, it's somewhat argumentative, I suppose, but you can ask her understanding of that if you want. You start to ask another question. So you were drawing that question?
I'm withdrawing that question. So, forensic...
He is very, very rude, and he doesn't get any nicer.
Pathologists took blood cultures and you said that they're not reliable. Forensic pathologists took a CAT scan. You said that's not reliable, right?
I disagree with your first statement. Forensics pathologists don't take blood cultures. Physicians treating patients take blood cultures when they present, or when they're in the hospital.
But you disagreed with some of the things that Dr. Odasa did, right? You said they were of no value.
I disagreed with a post-mortem lung culture.
Okay. You said it was of no value.
Right.
And the CAT scan of no value.
My understanding was that the CAT scan was ordered by someone else, but I might be wrong about that.
Okay.
But yes, that it's not interpretable.
So, how many dead bodies have you worked on?
Have I worked?
Yeah, recently.
None.
None. When was the last time you did an autopsy?
The last time I did an autopsy was when I was in medical school.
And that was what, 10 years ago?
Well, thank you. But no, it was in 1979.
1979. So that was the last time you did an autopsy, right? So you have no experience in forensic pathology?
That's right.
You have no experience in working on dead people?
No, luckily most of my patients are alive when I take care of them.
Okay. And most of your patients are young?
Right.
All of your patients are young?
I would have you tell me what young means to you.
I'm sorry, I thought you said you were a pediatrician. I'm just a lawyer. What do pediatricians work on?
We take care of primarily children, but
I take care of 34 and 40-year-old patients who acquired HIV as children. So you might say that I take care of some people who are not young.
What percentage of your practice is dedicated to adults as opposed to pediatrics?
About probably 8%, in that ballpark.
So 92% of your practice is dedicated to living children,
That's true.
not dead children.
Yes.
So now you read, I'm assuming, maybe I'm assuming wrong, but you read through a lot of the materials, right? You went through a list with Ms. Schroen about all the materials you read in this case, right?
All the discovery that I was asked to review.
Okay. And who asked you to review it?
The prosecutor's office.
Okay. And as part of that, did you review, you know who Dr. Ragasa is, right?
No.
Okay.
I mean, I know from what I've read that,
Okay. Was he the medical examiner in this case?
yes.
So, do you remember reading anything from a Dr. Larkin?
I don't believe I did.
Okay. So, do you recall reviewing any reports that Dr. Larkin ordered?
I believe that Dr. Larkin ordered, I think I read that Dr. Larkin ordered the CT scan.
So then you do know who Dr. Larkin is.
I just know the name, that I read it once.
Do you know if he requested any other exams?
I know that there was toxicology done, and I don't know who ordered that, but I only think, I recall seeing his name in regards to the CT scan.
So you don't recall whether Dr. Larkin ordered any other tests?
I don't.
So now, you got paid, right, to review this case?
Not yet, but yes.
You're going to get paid for reviewing the documents provided to you by the prosecution, right?
I expect yes.
Okay.
No, she's going to work for free. The hell kind of question is that, Gallucci? I mean, he is... The way he's talking to this woman, it seems so insulting to me. It is really fitting that he is Monster Dad's attorney. You're going to get paid for this, right? Well, I hope so. Of course. Aren't you getting paid? I think so. Duh.
And you're going to get paid for discussing it with them, right? Or did you meet with Ms. Schron or Ms. Lento prior to walking through those doors?
Yes.
Okay. And when you met with them, did they discuss the case with you?
Yes.
Okay. I don't know if either one of them, I'm assuming neither one of them have any medical degrees. So did you explain to them the medical technology?
Yes.
You did so right here. When Ms. Schron asked you a question, you actually corrected her on the words she used, right?
Not on the word, but on the pronunciation of the word.
And I'm sure you're going to do that often to me right now. So, and you're actually getting paid to sit right here and testify for them, right? Or you expect to be, right?
Yes.
This is such crap. I mean, obviously, expert witnesses are getting paid for what they're doing. You don't volunteer when you're an expert, you're a doctor, you don't go, oh sure, I'll work for free. I'm going to do all this work and then come into the courthouse and just sit here for hours on end and not do my regular physician work. I mean, how ridiculous. The line of questionings from this attorney is just, it's so stupid. I mean, I'm not saying he's stupid. I'm just saying the way he's talking to her is, to me, he's talking down to her. And this is a doctor that has been practicing since the late 1970s. I mean, come on.
Do you know how the medical examiner's office works?
What I understand is that the medical examiner is hired by the state, and when an autopsy is indicated, there's a question as to a patient, whether the death was natural or unnatural, then the case can be referred to the medical examiner to try to make that determination.
So you said something very interesting. You said that the medical examiner is paid by the state, right?
That's what I understand,
Okay, not paid by the prosecution.
as far as I know.
So the medical examiner in this case was Dr. Ragazza, right?
Objection, Judge, misinterpreting. We go to sidebar, Your Honor.
Sure.
I really don't know what Gallucci's point is here. But, I mean, he's not even getting to any good questions. It's almost as if he just wants to try to discredit her. And yes, that is part of his job, to try to poke, holes in an expert from the state. I get that. But the way he speaks to her, and he just comes out of the gate, it's like, hey, what do you know? Do you know what a forensic pathologist is? Do you know what an ME is? Who pays for that? The state. Oh, not the prosecutors. Well, I think the DA's office and the state, they kind of, almost are together there, buddy. But irregardless, I mean, he really rubs me the wrong way. Monster Dad's attorney.
Ladies and gentlemen, Mr. Blue is going to rephrase the question. We'll continue. Thank you for your testimony.
Did Dr. Ragazza perform the autopsy on Corey?
Yes,
Okay. And did you review the autopsy report prepared by Dr. Ragazza?
I did.
Did you also review the death certificate that Dr. Ragazza prepared? The original death certificate?
Yes, I
Okay.
believe I did.
Okay. Do you recall that the original death certificate that Dr. Ragazza created found that the cause of death was due to cardiac arrest?
Yes,
Okay. Do you recall that Dr. Ragazza, the person who did the autopsy in this case, found the manner of death in his initial report to be undetermined?
yes,
Okay. Now, before you testified here, you actually on direct examination said that you reviewed Dr. Andrews' report.
yes,
Okay. And do you know who Dr. Andrews is?
yes,
Okay. Did you review his testimony prior to testifying here today?
I did not.
Do you know what the manners of death are? I know that you're not a forensic pathologist, but do you know what the manners of death are?
Objection, Judge. We're getting outside the scope of what she testified is her area of expertise. We're talking about forensic pathology, and she's an infectious disease specialist.
Judge,
Even talking about causes of death, she's an infectious disease specialist, and she ruled one out, not determined one.
Yeah.
Overruled. It goes to her knowledge.
Thank you.
Testified as the sepsis not causing it, so it's approved.
Do you know what the 5 manners of death are?
I think I have heard them.
Okay.
I'm not an
You
expert
don't know
on them.
them. You don't know them, right?
No, I could come up with most of them, I believe.
Well, I wouldn't want you to do something that you don't know, right? You're not a forensic pathologist, right?
That's true.
You don't work on dead bodies, right?
That's true.
Do you evaluate a lot of autopsies in your pediatric practice?
Yeah, but it has these two things.
No, not a lot.
Okay. As a matter of fact, today is and welcome, by the way, today's the first day you're actually testifying in a courtroom.
That's true.
Okay.
Yeah. Come on, Galucci. You started out asking her what a forensic pathologist did, or was, and then you're trying to ask her what the 5 manners of death are, and oh, but you're not a forensic pathologist. Hello! You answered your own question. Again, like the prosecutor said, this is out of the scope of her knowledge. This is not her area of expertise. Get to her area of expertise. She is not here as a forensic pathologist.
Are you aware that the autopsy report was amended? The death certificate was amended almost 1 year later.
Yes.
Okay? And do you recall why it was amended?
No.
You don't. Did you do any forensic examination of Corey?
No.
Did you review any slides from the autopsy?
I reviewed the slides from the autopsy.
Okay. You also reviewed a 33-second video, am I right?
Yes.
Okay. How many words, by the way, did you see Corey in that video?
No.
So if I'm a pediatric patient, right, and I walk into your office, is one of the things you want to do is look at me?
Yes.
Okay. You would find that helpful, right?
Absolutely.
Okay. Now, do you recall how many words Corey said in that 33-second video?
No, I don't recall. It wasn't very many.
Would it surprise you that it was 8?
No.
Were you able to make a medical diagnosis based upon a 33-second video that Corey Michello allegedly says 8 words and you can't see him?
No.
Now, you said something about the way, and I'm not a doctor, that it indicated to you that there was an acute stress response. I believe you said it released epinephrine?
Epinephrine.
Epinephrine. Right? So, as you sit here now, were you able to determine what that acute stress response was caused by?
Not able to determine, but I have an idea since
Now, is an idea within a reasonable degree of medical certainty, or is it just an idea?
no, it's with some medical certainty because the description of Corey when he presented was clear that he was extreme or in extremis, and that I have seen many times.
Okay. What does acute mean? Has a particular meaning, I'm assuming.
In general, it means in a short amount of time, but it's variable for different things.
What does that mean?
It means that when something happens, acute may be within the last 12 hours or it's used to describe a medical condition that comes on very suddenly.
But it could come on suddenly 12 hours ago?
It could.
24 hours ago?
It could.
So, I don't know if you've done this, but you're a pediatric infectious disease specialist. Have you ever had occasion to perform CPR on a 6-year-old?
Objection, Your Honor. Did we lay a foundation for emergency medicine with the doctor? She's an infectious disease specialist.
Well, she treats children, so the question is, did she ever have occasion to do that? I don't know if we gave you a foundation for that. It's an open-ended question, so it's acceptable to answer that.
I have performed CPR in the past, but I do not recall the ages of the children that I've participated in a resuscitation.
What children ages do you normally treat? Let's do that way.
Really, all ages.
Okay. Now, Ms. Shaw just made a very, very good point in her objection. How much emergency room treatment do you perform?
I am not infrequently asked to evaluate children in the emergency department, but that's only after they've already been seen by an emergency room physician.
So do you have emergency room experience?
Only that which occurred during my training.
Which was, do we say 10 years ago?
We could say 10 years ago. I'd
Okay.
be fine with that.
So,
He just is so frustrating. He is so frustrating. And I admire the doctor's patience with him. I really do. Because I know the prosecution is so fed up with Gallucci right now. And thank goodness this witness, she's trying to grin and bear his insanity.
experience in forensic pathology. You have no experience in emergency room, whatever we would call it, care, yes, right?
That's right.
But you have performed CPR on children.
Many years ago, yes.
So when you perform, do you know how to perform? I mean, it's many years ago, maybe you forgot. Do you know how to perform CPR on a child?
It's been many years since I've even certified to do it.
Okay. So you don't remember how to do CPR on a child?
Not specifically.
Okay. So for
I
sure.
couldn't teach it for sure.
But could you do it?
I imagine I could do it, but it doesn't come up in my daily physician service.
So if I was to ask you, doctor, can you explain to this jury how you perform CPR on a child? Would you be able to answer that?
Your Honor, she just said she can't teach it. She doesn't do it.
She said
It's
she
asked
can
and
teach it.
answered in 3 different forms.
I mean, one additional time would be sufficient for that.
Say, could you
Ms.
repeat the
Holtz, Can
question?
you repeat my question?
Sure.
Thank you.
Wow. Wow. The level of frustration and my blood pressure going up with everything that comes out of this attorney's mouth, it's high. It is high. I guess he's earning that paycheck from the Gregors, isn't he?
So if I was to ask you, doctor, to explain to this jury how to perform CPR on a child, would you be able to do that?
No.
Do you know, only if you know, can CPR cause injuries?
Yes.
And where do they typically cause that injury?
To the sternum and ribs chest wall.
But you have no pathology experience, so if I asked you what percentage of autopsies do you see an injury to the heart and the lung, you wouldn't be able to answer that, right?
Objection, Judge. Counsel just answered his own question within the question.
I'll withdraw objection. Thank you. So, which community pneumonia.
I believe that the expression you're trying to refer to is community-acquired pneumonia.
Okay. And can you tell me what that is?
It's pneumonia that's acquired in the community as opposed to pneumonia acquired in a patient who's hospitalized.
So would that be hospital-acquired pneumonia, otherwise known as HAP?
Yes. We
And-
usually call that nosocomial pneumonia.
What's that one?
Nosocomial.
Okay. So when a patient presents to a hospital, their initial diagnosis couldn't be HAP or hospital-acquired pneumonia. Am I correct?
You're correct.
Okay. But hospital-acquired pneumonia can develop between 12 and 24 hours later. Could it not?
Not by the definition. The definition is pneumonia that occurs 48 hours after an admission, a sustained admission to a hospital.
Okay. So, is your testimony that in order to get hospital-acquired pneumonia, somebody needs to be in a hospital for a sustained amount of time for at least 48 hours?
Yes.
I have no further questions, Judge. Oh, wait a minute. Let me speak. We're good.
And when he said, I have no further questions, she's going, praise the Lord. I'll tell you what, he is one annoying attorney.
Anything from the state?
Dr. Feingold, as an infectious disease specialist dealing with children, it's your job to look at blood results, correct?
Yes.
It's your job to look at test results, right?
Yes.
It's your job to look at everything, a case history, and determine if there's an infectious process present, correct?
Yes.
Or to rule it out, correct?
Yes.
And in this case, you were paid for your work to determine if you could rule it out, right?
Judge, I'm objecting to the leading.
I mean, that's true. You should, you're asking each question like right afterwards. You could ask her.
Dr.
more open-ended
Feingold,
question.
did you rule out any infection in this case? A pneumonia infection in this case?
Objection. Is that two questions or one question?
It's one
First
question,
is-
Judge, it's a clarification.
That's back. Redirect as based upon the cross, so that's appropriate. It's overruled.
Thank you, Your Honor.
There, in reviewing everything I reviewed about this case and what I know from 40 years of taking care of children, 30 specifically taking care of children with infections and teaching others to recognize infections in children, there was no evidence in anything that I reviewed that there was any infection in this boy.
I have nothing else, Judge.
And that's what you call a mic drop. Gallucci and his cohort there, I don't know her name. She's been there a few times. But Monster Dad's attorney can throw all the rude comments, the rude questions, all that. He can try to see what sticks to the wall. But the fact remains, Corey didn't die of pneumonia or sepsis. He didn't die of any of that. Corey was abused and beaten to death. Period. And It has been so clear what happened to this poor kid. I believe the jury has seen it, and I have faith that they are going to come out with the correct verdict. There has been a number of great experts that have come out that have explained this well. We had the forensic pathologist. He was excellent. She's also very good. No, she doesn't have experience with autopsies and dead children. But God, can you imagine? You have experience with dead children? No. I don't think she wants to deal with dead children. Do most people want to deal with dead children? I don't think so. It's an awful thing. I mean, unfortunately, there are people who have to deal with it. The ME's office deals with all ages, but the bottom line is there's been way too much evidence to support that Corey was abused to death. And hopefully when this is all said and done, the right verdict comes out, and Christopher gets to spend either the rest of his life or a good portion of his life behind bars. All right, guys, that's all I've got for this one. I'll probably do at least another couple of videos. I know that they have, I think they're doing, they're in tomorrow, which is Thursday and Friday. It's a little confusing to me on which days, so I'm kind of trying to keep track of it through Law and Crimes trials. So, but it looks like the jury won't have the case until after Memorial Day anyway. So, yeah. All right, I hope you have a great rest of the day, and most of all, stay safe.